The end of the first small session of ours, and we would like to have an enriching discussion. If anybody has anything to add to the first presentation by Farzana John and the second presentation by Arzu, please raise your hands and Mike will come to you. And we are just trying to get ideas or anything that anybody may want to add or comment on. This may carry on for at least 10 minutes or so. If anybody wanted to ask anything or add anything, please feel free. Okay, I thought I'll start it myself. Arzujan, I thought your recommendations were one of the great ones, and I thought the scholarship idea was brilliant. I know it is really hard to get a scholarship to the UK and other countries, but a scholarship particularly to women medical students are one of the vital ingredients for the future benefit of the Afghan woman to have the access for better health care. Because our tradition is that some of our fellow countrymen do not like their wives to go to the male doctor. So I guess one of the solutions will be there. If anybody likes that recommendation, raise your hand. Great. Anything else with the Farzan and domestic violence? Domestic violence, to be honest, is not particularly specific to Afghanistan. It happens still here. Well, degree of Afghanistan is rather devastating.
My name is Dr. Fahim Behzad. I'm one of the doctors from Afghanistan, but lately I'm living in the United Kingdom. Regarding the well-prepared article of Ms. Qadri, I think it was very well prepared and well researched on it, but I think the dates were a bit old, and it was from 2002 or 2005, so it was not something over 2010. From my point of perspective, from my point of view, there's a rapid change apparently in Afghanistan healthcare system. First, the mortality rate is not that high as it is mentioned now in that paragraph. And they are rapidly, the Ministry of Public Health in Afghanistan, they are trying very hard to overcome the problems. Well, one of the problems still stands in rural area, which is, as she said, that some people even don't know, haven't seen a doctor. I have experienced it myself. I was one day in a rural area with my mom, and there were kids, there were women walking behind us and calling my mom, doctor, doctor, doctor. So it is a proof that most of the people who are living in rural area, they don't have access to healthcare system. But not to forget, there's a huge number of population who are living in cities, major cities, like Mazar Sharif. There's lots of hospitals. As she said, there's lots of hospitals in Kabul, not other places. There's like public health hospital in Mazar Sharif, which is government-based, and there are like 5 or 10 private hospitals, which are very standardized, which can go to, can compare themselves to neighboring countries. So they provide very good standard healthcare system. But well, that's my comment. I'm not like saying she hasn't well prepared, but that was my comment as a doctor. Thanks so much.
No evidence to the contrary that she was well prepared. Thank you so much, Fahim Behzad. You want to comment back, or I would just say that the problem is still persists, although you're right, it's rapidly changing and it's improving, and one of the great points is that the Ministry of Health, the minister, is one of the intelligent ladies that we have asset to our country. But yes, cities have improved, but rurals are still having devastating issues. We will go to the next question.
My name's Matthew Rice. I'm the Volunteer Policy Coordinator for the European Campaign for Human Rights in Afghanistan. Regarding Arzu's presentation again, and I think it's very important to be using these statistics from Sweden and places like that. But I just wonder whether we're placing too much of a burden. We have to realise how what level Afghanistan really is at this time. And if we look at these societies like Sweden, better healthcare provision than like a lot of Europe across the board, are we placing too much of a burden on Afghanistan to be up to a level that maybe not feasible in the next decade or something? Should we be a bit more pragmatic, a bit more realistic about what can really be achieved? And like the doctor said, there have been progress. There has been progress made, and should we not be much happier with that at this point in time and looking to build on that rather than setting this bar so high to be looking at Scandinavian countries with an egalitarian system and stuff? That's all.
Great. Anybody want to comment on that or agree? I would say yes, definitely. We cannot compare ourselves with one of the first ranking countries, Scandinavia. I never get to pronounce that word right. That country, of course, in every index of the world, that country stands first. Yeah, that will be a bit injustice to both us and them. But relatively speaking, and really considering the 10 years of investments and all the attention that the world has given to our country, we would have expected a bit of different status today. Anybody else would?
Neris Bannister from the International Rescue Committee. I just wanted to pick up firstly on the issue of reproductive healthcare. It is true that with the two large studies of maternal and child health, the most recent one has shown a dramatic improvement in the statistics, but you have to look at the story behind the statistics and how they were collected. The fact is that the scope of that study was vastly reduced because of the security situation, and researchers simply couldn't get there. So ongoing conflict, which is deteriorating, and all the scenarios, well, 4 out of the 5 scenarios suggest that things will only deteriorate as we move towards 2014, is that not only is the conflict affecting our ability to understand the situation, but it is also further compromising the ability of women and children, especially, but people in rural areas to access healthcare. And on the subject of domestic violence, it's a very, very interesting presentation, and I don't have a comment, so much of a question. As an organisation that works in Afghanistan, but not on the issue of gender-based violence, but globally does a lot of work on gender-based violence, the issue of raising awareness and being able to talk about it within communities and within the household, I thought was very interesting, acknowledging that it's something that you feel that is important, while also the fact that it is considered something very private. So I'd be really interested to hear what people's thoughts are, what the entry points are. So how can this conversation be started? Globally, there are examples of that conversation starting around household management of resources, and sort of looking at the health of the household, and then sort of extrapolating that into looking at the health of women and the status of women within the household. But that is just one example of the many entry points, and so I'd be very interested to hear what people thought the entry points to start that conversation would be within Afghanistan.
Great. You're absolutely right. There are things that are happening. The day before yesterday, Times announced one of the 100 most influential figures of the world, and surprising enough, one of them was one of the Afghan women called Mariam Durrani. She is part of the Provincial Council in Kandahar, and she has a radio station within Kandahar preaching women's rights, women's health issues, all the concerns that you just raised. Media is helping to some extent. There are NGOs that have started this work. Of course, they have miles ahead to go, but there has been initiatives by NGOs. And a couple of days I was talking to the women rights activist in Afghanistan, Soya Parlika, one of the most influential ones, and she suggested that women's rights activists and different groups have been very effective, more than what we have heard so far, in raising awareness and trying to create platforms where people could come and talk and then raise awareness in regards to domestic violence, women health issues, all the rest of it. Of course, there are loads to be done. We will have further discussions on different topics. Just 5 minutes or less than 10 minutes. Brief discussion on peace process and integration, and then we will move on to our second
My name is Abdul Wahid Ahmadi. I just want to ask a question from Mr. Faid. Since we know that Pakistan has so much influence inside Afghanistan for the past 3 decades, why the Afghan government cannot consider the sensitivity of Pakistan inside Afghanistan, and why we cannot coexist with Pakistan, since they have a lot of cards inside Afghanistan, inside political arena of Afghanistan, that they can play with that card anytime, in any place. They have a card inside Parliament, and also I just want to make a comment on the topic that Ms. Nawbaha said. I think the fundamental issue about women in Afghanistan is the lack of communication, and also the lack of knowledge of the rights of both men and women. There's not a very clear definition of women in Afghanistan for a man. They just see a woman maybe as a sexual human
property.
Yeah, something like that. The reason I'm saying this is that if we want to fight for the women, we have to fight first men. Men are the main problem. If we want to educate the women, we have to educate the men to give rights to the women. If you just go and fight the women for the women, first you have to fight the men. Because they think that,
Thank you.
I think Pakistan does not see the current government as a reliable partner, and they are not basically account on Karzai regime or government, because it's not legitimately. So Pakistan tries to play with current regime as they played for the past. So it needs for more study about this issue. Thank you very much.
Thanks. I'm afraid we need to move on to other questions.
I just would like to say, sorry, I didn't catch your name.
Ms. Nawbaha.
Okay. I just wanted to say that your speech was unexpected but great. And I also would like to say that our mothers and sisters, I'm sure they will hear your message and they will be delighted that women outside Afghanistan are thinking of them, thinking about them, trying to make effort in making a change. And I guess it probably is a nice feeling for them that we actually give a speech and think about them. So well done for giving that speech.
Thank you. I guess well done to all of our fellow participants here who are young and who are dedicated, who have put that personal time on this. I'm sure their life is much better than Afghan women in that country, but they still feel the need to come and work voluntarily in this organization.